A community health assessment or a community health needs assessment is really important as a tool to begin to improve your community's health and well-being. You really need to take a good look at various factors that affect health and well-being, not just the health outcomes, but the social services in your community, the transportation, the safety of the community, food access, and there's various ways to get that information, both from the healthcare system, from the transportation office, from the regional planning office, as well as from the Census Bureau. And then really important is to talk to the people in the community and find out what is important to them. So the most important part about truly improving the health of your community is working with the people in the community, both the ones who live and work and play in the community and other organizations. The hardest part about this is the working together, because of the fact that the more people you work with, the more complicated and challenging it is, and yet the biggest, longest lasting impact you'll have. You know, there's that old African proverb, if you want to go fast, go alone. If you want to go far, go together. But going together takes a longer time, and that's really difficult, but really, really vital for a long-lasting impact on the health of your community. We have an infographic that talks about investing in your community, 4 considerations to improve health and well-being for all. There are 4 main points. First one is what? Know what impacts health. Where to focus to have the greatest impact on health in your community. Who to collaborate with lots of different partners in your community. And how to have a balanced portfolio of interventions for greatest impact. Know what impacts health. You know, too often people think of health as just about health care. Health care is not enough to impact health. There are other factors that we can affect that'll improve health. There's socioeconomic factors, there's the physical environment, and there's health behaviors. Healthcare alone actually has a very small impact on health. Some would say no more than 10 to 20% of the impact on health. As far as where to focus to have a great impact on health, your zip code can be more important than your genetic code. Where you live affects your health. And the reason we emphasize where is that there will be these places, there'll be the parts of your community where there are folks who have very little to no access to healthy food, difficulty with transportation, a lack of safety in their community. And if we can address those kinds of factors, we can have a greater impact, a longer lasting impact on the health of the community, and also affect health equity. Who to work with in the community? I think we're trying to make the point that there are many, many partners out there. This country spends a lot of money on health care, and on balance, many fewer dollars on social services. And yet these social determinants, these other factors, impact health. There are a lot of partners out there who recognize the importance of their role in affecting health and are ready to collaborate with us in public health and health care. For example, there are YMCAs and United Ways and community health centers. There's community development agencies. There are businesses who recognize the impact of health on their economic well-being, and they're ready to partner with public health and health care. So we really want to emphasize the who to work with is very, very great. The opportunity is enormous. The 4th bullet is the how, and we say you need to use a balanced portfolio of interventions to have the greatest impact. Balanced or diversified, like what you would do with your own funding if you have enough, where you wouldn't put all your money in one basket. You might invest in different stocks or different approaches to have the best impact on your portfolio funds. We need a portfolio of different interventions, multi-pronged, to have impact on health. For example, we have this enormous obesity epidemic, and oftentimes clinicians are advising their patients or their patients' families to eat healthier, to be more active, and that's what we often do in the clinical arena. Hopefully we also connect them to nutritionists so that they understand what is healthy food and how to access it. But the challenge is that it's not enough to approach a complex problem like obesity just in the clinical arena. We have to help them understand what motivates them, what kinds of health behaviors they can engage in terms of healthy food, physical activity. But then the challenge is, if we say go off and eat healthy food and be active, what if they live in a neighborhood where they're afraid to go out at night, or they are afraid to go out on the streets, or there aren't any places to exercise because the traffic patterns are such that it's dangerous for the kids? We need to work on their housing and the zoning so that they have situations where they can get out and exercise. Also, we know that the education has an important impact on health. So if we can think about educational programs, perhaps programs for preschool, we may have a big impact on their health outcomes. The Practical Playbook is all about working together, and it's really so important. We are not going to solve the health problems of the United States by working alone or in silos. We have to work together. That's the purpose of the Practical Playbook, is to really support us, primary care, public health, and other partners in working together. People think that it's about science and about medicine, but really, and I'm a scientist, it's about the fuzzier stuff of working together. The Practical Playbook addresses those issues head on. It talks about the importance of collaboration. It brings up those challenging issues that we find when we try to work with people from other disciplines, which are so, so important. There's stories about how people have worked together and achieved success. Working together can be hard. We all work and come from our own frameworks, and we don't always understand the other players, our partners. One of the things the Practical Playbook has is perspectives from public health, perspectives from primary care, so that we can understand each other and be more effective in working together.